Hello everyone, welcome to my YouTube channel Nursing Education. My name is Pinky and today I'm here with another topic which is a must malnutritional universal screening tool. So before moving further, if you have not subscribed to my channel, please consider subscribing it and press the bell icon to get more video. If you are going to give the OSCE exam and if your patient is with the diagnosis of malnutrition or is at the risk of malnutrition, then you have to complete MUST as well as the news score starting in the OSCE exam. Malnutritional universal screening tool is a screening tool to identify adults who are at the risk of malnutrition or is malnourished. It is the most commonly used screening tool in the UK and it is suitable for use in the hospital, community and any other care setting. So in OSCE exam, you will get this paper and this paper will be the pre-filled where the patient name, date of birth, medical record number, height, weight will be already written and also the circle is already present in the step 1, step 2, step 3 based on the patient condition. So step 1 is BMI score of the patient and then step 2 is unplanned weight loss in last 3 to 6 months and step 3 is acute disease effect score. So in the OSCE exam usually you would not have the step 3 and to confirm with the patient you should ask the patient when the patient had last food. If the patient had last food is more than 5 days, then the patient will come under the step 3 and then the patient would score in this. What you have to do is you just have to calculate this score and write down here in the total score and you have to write date, time and signature. And based on the patient score in the MUST, you have to provide the health education to the patient. So in OSCE exam, this part will be the pre-filled and you have to complete this part. So if you see the score of the patient, the total score of the Sumera Patel will be the 2. And if you see the risk of the malnutrition for the Sumera Patel, then the Sumera is at the high risk of malnourished. And based on this, you have to provide health education to the Sumera. In the malnutrition universal screening tool, there are 5 steps. So the first step, you have to calculate the BMI from the weight and the height of the patient. Second step is weight loss score. So suppose if the patient current weight is 30 and the patient has lost 1.6 kg, then the patient is scored 0 because the patient has lost just less than 5%. If the patient has lost 1.6 to 3.3, then patient is in the score 1 and the weight loss is 5 to 10%. If the patient has lost 3.3 kg in the last 3 to 6 months, then the patient will come under score 2 and that the patient has lost more than 10% of weight. So this chart you can use to calculate the BMI of the patient or to confirm the BMI in the exam. So here the weight is in kg this side and this side the weight is given in the stone or and the pound. And this side the height is given in the feet and inch and this side the height is given in the meter. So you can use any of these. Suppose the patient weight is 60 kg and the patient height is 1.52. So the patient BMI will be the 26 and the score is 0. So you can use this chart to calculate BMI very easily. So this is a 5-step of malnutritional universal screening tool. The first step is BMI score, second is weight loss score, third is acute disease effect score. So these 3 steps is already done in the OSCE exam. You have to do step 4, overall risk of malnutrition. You have to add all the score together and you have to calculate overall risk of malnutrition of the patient. If the patient scores 0, then the patient is at low risk and you just have to do routine clinical care. If the patient is score 1 and the patient is in medium risk, then you have to do the observation of the patient. If the patient is score 2 or the patient is in high risk of the malnutrition, then you have to treat the patient. So in the OSCE exam, usually you will have the patient with the most score 2, and you have to treat the patient, or you have to advise all those things which is written in this chart to the patient. So step 5 is a management guidelines. So if the patient is at the low risk, you just have to do the routine clinical care to the patient. You have to repeat the screening. If the patient is at hospital, you have to repeat the screening weekly. If the patient is at care home, then you have to repeat the screening monthly. And if the patient is at community, then you have to do the screening annually, especially for the group who are the age group of more than 75 years. If the patient is at risk of medium, then you have to observe the patient. You have to ask the patient to maintain the food diary at least for the 3 days, where the patient will write each and everything they are eating for the breakfast, for the lunch, for the dinner in the paper, and then you can see what the patient is actually eating, whether that is a nutritious diet for the patient or not. And if the patient is eating adequately, then you have to just put the little concern for the patient and repeat the screening. Then you have to do the screening. If the patient is in hospital, then on a weekly basis. If the patient is at care home, then at least monthly. If the patient is at community, then at least every 2 to 6 months. If the patient is not eating adequately, then that is a clinical concern, and you have to follow the local policy. You have to set the goal for the patient nutrition, and then improve the nutrition and increase the overall nutrition intake of the patient. You also have to monitor and review the care plan regularly. So if the patient is at high risk of developing malnourished, then you have to treat the patient, and first thing you can ask the patient about their dietary habit, what they are eating, and also you can ask the patient to complete the food diary, so the patient will write each and everything they are eating. And then you have to refer the patient to the dietitian, and you have to gain consent in the OSCE exam for this. And then you can also give the food diary to the dietitian, so the dietitian can see what the patient is actually eating, and based on that the dietitian can plan the food for the patient. Also, you have to see whether the patient is having the money for the food. If the patient don't have the money for the food, or patient cannot afford the food, then you can see for the nutritional support team. And there are some organization who is providing food to the person who can't afford in the UK, so you can ask the support from them. And also based on the local policy, you can implement for this. And you have to set the goal for the patient, and then you have to improve or increase the overall nutrition intake of the patient. And also you have to monitor and review the care plan weekly basis if the patient is in hospital, and then monthly basis if the patient is in care home and then community. Thank you for watching. Please like my video and subscribe to my channel if you have not subscribed it, and press the bell icon to get more video. Keep watching, keep supporting. Thank you.